Have you ever wondered about the complexity of the human mind and how it can sometimes lead to mental health disorders? The human mind is indeed a fascinating entity, a marvel of evolution, and a testament to the power of adaptation. Yet it is also a fragile construct, susceptible to a myriad of disorders that can significantly impact an individual's life. Mental health disorders are more common than we might think. They span a broad spectrum, ranging from anxiety disorders that trigger fear and apprehension, to mood disorders that cause extreme emotional fluctuations. Psychotic disorders distort reality, while eating disorders are characterized by obsessive concerns with food and weight. Personality disorders reflect inflexible and unhealthy patterns of thinking, while obsessive-compulsive and related disorders showcase intrusive thoughts and repetitive behaviors. Trauma and stressor-related disorders, on the other hand, are a response to distressing events. As we delve into this topic, remember that understanding is the first step towards compassion and support. Picture this: your heart races, your palms sweat, and your mind is filled with worry and dread for no apparent reason. This can be the reality for those suffering from anxiety disorders. Anxiety disorders, a broad category of mental health conditions, are characterized by persistent, excessive, and often irrational fear and worry. They are more than just occasional anxiety or nerves. They are chronic, relentless, and can interfere with your day-to-day life. They can manifest in various forms, each with its own distinct set of symptoms. For instance, there's generalized anxiety disorder, or GAD. People with GAD experience a constant state of worry and tension, even when there's little or no cause. The worry is often out of proportion to the situation, making it difficult to relax and often leading to physical symptoms like headaches or nausea. Then there's panic disorder, characterized by recurring unexpected panic attacks. These intense bouts of fear can trigger severe physical reactions, making the person feel like they're losing control or having a heart attack. Social anxiety disorder, on the other hand, involves an overwhelming fear of social situations. People with this disorder worry excessively about being embarrassed, humiliated, or scrutinized by others. But it's not all doom and gloom. Anxiety disorders, like most mental health conditions, can be managed with the right treatment and support. Cognitive behavioral therapy, for example, can help individuals understand and change thought patterns leading to anxiety. Medications such as selective serotonin reuptake inhibitors can also be effective in reducing anxiety symptoms. Support from loved ones, self-care practices like regular exercise and a healthy diet, and joining support groups can also play a crucial role in managing anxiety disorders. It's important to remember that everyone's experience with anxiety disorders is unique, and what works for one person might not work for another. That's why it's key to seek professional help if you or someone you know is struggling with an anxiety disorder. Anxiety disorders are more than just feeling anxious. They can impact every aspect of one's life. Imagine being on an emotional roller coaster that you can't get off. This can be the daily experience for those living with mood disorders. Mood disorders, or affective disorders, are characterized by a significant disturbance in a person's persistent emotional state, or mood. This isn't just about experiencing the usual ups and downs of life, but rather, these are intense emotions that can interfere with everyday activities. The most common types of mood disorders are depression and bipolar disorder. Depression is more than just feeling sad or having a bad day. It's a condition where feelings of sadness, loss, anger, or frustration interfere with daily life for weeks or even longer. On the other hand, bipolar disorder, formerly known as manic depression, leads to severe high and low mood swings, with periods of normal mood in between. Let's consider an example. Meet John. He's been feeling persistently sad, hopeless, and has lost interest in things he once enjoyed. He's having trouble sleeping, and he's lost his appetite. These symptoms have been going on for more than 2 weeks now. John is likely to be experiencing depression. Then, there's Lisa. She experiences periods where she feels overly happy, extremely active, and it's as if she's on top of the world. But then she has periods where she feels just like John, hopeless, sad, and uninterested. Lisa could be dealing with bipolar disorder, but here's the silver lining. Mood disorders are treatable. Treatment typically involves a combination of medication and psychotherapy, and it's tailored to meet the needs of the individual. Support systems also play a crucial role in managing mood disorders. Peer support, where individuals connect with others who are experiencing similar challenges, can provide a unique perspective and understanding. Family and friends can also provide much-needed support, but they too may need guidance on how best to help their loved ones. Mood disorders are not simply feeling happy or sad, they are a serious health concern that requires understanding and support. Hearing voices, seeing things that aren't there, these are just a few of the symptoms that those with psychotic disorders may experience. Psychotic disorders represent a collection of serious mental health conditions that distort a person's perception, thoughts, and actions, often making it hard for them to distinguish what's real from what's not. Hallucinations, delusions, and disordered thoughts or speech are some of the most common symptoms. Imagine hearing voices that others cannot hear, seeing things that others cannot see, or believing in things that others find absurd or impossible. This is the reality for many individuals living with a psychotic disorder. Schizophrenia is perhaps the most well-known among these disorders, often characterized by periods of psychosis that include hallucinations and delusions. But there are others as well, like schizoaffective disorder and brief psychotic disorder, each with its own unique set of symptoms and challenges. Living with a psychotic disorder can be incredibly challenging, not just for the individuals themselves, but also for their families and friends. It can affect their ability to work, study, maintain relationships, and even perform day-to-day tasks that many of us take for granted. But it's not all doom and gloom. There are a variety of treatment options available, and they've come a long way in the past few decades. From medications to psychotherapy to community support programs, there are resources available to help individuals manage their symptoms and lead fulfilling lives. One such example of a treatment is antipsychotic medication, which can help to reduce the intensity and frequency of psychotic episodes. Cognitive behavioral therapy, on the other hand, can assist individuals in managing the impact of symptoms on their lives. Community support systems can also play a crucial role in recovery and management. These can include support groups, housing assistance, vocational training, and more. With the right combination of treatment and support, individuals with psychotic disorders can live meaningful, productive lives. Psychotic disorders can distort an individual's perception of reality, but with the right support, they can manage these symptoms. Food, a source of nourishment, can become an object of obsession, fear, and control for those with eating disorders. Among the most common are anorexia nervosa, bulimia nervosa, and binge eating disorder. Anorexia is characterized by an intense fear of gaining weight, leading to self-starvation and an unhealthy thinness. Bulimia involves cycles of binge eating followed by purging through vomiting, fasting, or excessive exercise. Binge eating disorder, on the other hand, is marked by recurrent episodes of eating large quantities of food, often very quickly and to the point of discomfort. These disorders revolve around an unhealthy relationship with food and body image. They are not just about dieting or vanity. They can cause severe physical complications and can even be life-threatening. But what drives these disorders? A combination of factors, in fact. These may include genetic, biological, behavioral, psychological, and social influences, and they affect both men and women across all age groups and backgrounds. In real life, the signs can be subtle. A person with an eating disorder may become preoccupied with weight, dieting, and body size. They may avoid meals, eat in secret, or express guilt or shame about eating. Physical signs can include drastic weight loss or gain, feeling cold all the time, or in women, missed periods. The good news is, eating disorders are treatable. The first step is recognizing the problem and seeking help. Treatment often involves a team approach, including medical providers, mental health professionals, and dietitians. It may include therapy to address unhealthy patterns of thinking and behavior, nutritional counseling, and sometimes medication. Support systems are crucial. Friends, family, and support groups can provide a network of understanding and encouragement. Remember, recovery is possible, and the sooner treatment begins, the better the chances for physical and emotional recovery. Eating disorders are not a lifestyle choice. They are serious and often fatal illnesses. The struggle is real, but so is the hope. The journey to recovery may be tough, but every step forward is a victory. Let's continue to raise awareness, reduce stigma, and support those affected by these disorders. Together, we can make a difference. Imagine finding it hard to adapt to changes or having difficulty with relationships. This can be a reality for those suffering from personality disorders. Personality disorders are characterized by inflexible and unhealthy patterns of thinking, functioning, and behaving. People with these disorders often find it challenging to perceive and relate to situations and people, which can lead to significant problems and limitations in relationships, social encounters, work, and school. There are several types of personality disorders. For instance, borderline personality disorder often leads to intense emotional instability, impulsivity, and distorted self-image. Antisocial personality disorder, on the other hand, is characterized by a disregard for others' rights and a lack of remorse for wrongdoings. Narcissistic personality disorder, yet another type, involves a pattern of grandiosity, a need for admiration, and a lack of empathy. You might be wondering how these disorders affect daily life. Let's take an example. Someone with borderline personality disorder may have severe mood swings over minor issues, have difficulty maintaining stable relationships, or struggle with self-image, often leading to impulsive actions and self-harm. So what can be done? The first step is recognizing the problem and seeking help. Psychotherapy, specifically dialectical behavior therapy and cognitive behavioral therapy, have shown to be effective in managing personality disorders. Medications can also be used to treat associated problems like depression or anxiety. And let's not forget the important role of a strong support system. Family, friends, and support groups can offer understanding, advice, and encouragement. Understanding personality disorders is not always easy. They can be deeply ingrained and often coexist with other mental health disorders. But with professional help, individuals with personality disorders can lead fulfilling lives. Remember, mental health is a journey, not a destination. It's okay to ask for help, and it's okay to need it. Personality disorders can make life challenging, but with understanding and support, individuals can lead fulfilling lives. Imagine being controlled by constant thoughts, fears, or behaviors. This is a day in the life of someone with obsessive-compulsive and related disorders. Obsessive-compulsive and related disorders are a group of mental health conditions that center around patterns of uncontrollable thoughts or obsessions and behaviors or compulsions. These obsessions and compulsions can interfere significantly with a person's daily activities and social interactions. The most well-known of these conditions is obsessive-compulsive disorder, or OCD. Those with OCD may find themselves trapped in a cycle of obsessions, anxiety, compulsions, and temporary relief. For example, an individual might have a recurring intrusive thought about germs and cleanliness. This thought or obsession triggers anxiety, leading them to compulsively wash their hands until they feel temporary relief. However, the obsession soon returns and the cycle starts again. But OCD isn't the only disorder in this category. Body dysmorphic disorder, hoarding disorder, trichotillomania or hair-pulling disorder, and excoriation or skin-picking disorder also fall under the umbrella of obsessive-compulsive and related disorders. Each of these disorders has unique characteristics, but they all share a common thread: the presence of persistent, distressing thoughts and compulsive behaviors. It's important to remember that these aren't quirks or habits, but serious disorders that can cause immense distress. The good news is there are treatments available. Cognitive behavioral therapy, or CBT, has proven effective in treating these disorders. CBT helps individuals recognize and change thought patterns that lead to troublesome feelings, behaviors, or bodily sensations. Medications, such as selective serotonin reuptake inhibitors, or SSRIs, can also be beneficial. Support systems play a crucial role in managing these disorders. Having a network of understanding friends, family, or a support group can provide a sense of community and reduce feelings of isolation. It's important to reach out to a mental health professional if you or someone you know is experiencing symptoms of obsessive-compulsive and related disorders. Remember, it's not about getting over it, it's about getting help and working through it. Obsessive-compulsive and related disorders can be debilitating, but with proper treatment, individuals can regain control of their lives. Imagine reliving a traumatic event over and over again. This is the unfortunate reality for those with trauma and stressor-related disorders. These disorders are unique in that they often have a clear point of origin, a traumatic event that triggers recurring distress. One of the most recognized disorders in this category is post-traumatic stress disorder, or PTSD. It can occur following any traumatic event, from natural disasters and warfare to personal assaults. Symptoms generally include recurring nightmares, flashbacks, and severe anxiety. It's as if the mind gets stuck in a loop, unable to move past the traumatic experience. Similarly, acute stress disorder is another type of trauma-related disorder that occurs shortly after experiencing a traumatic event. It's characterized by feelings of numbness, detachment, and lacking emotional responsiveness. A less known but equally significant disorder is the adjustment disorder, which arises as a response to a stressful life event such as divorce, job loss, or the death of a loved one. The reaction to the event is more intense than what would typically be expected and can result in significant impairment in social, occupational, or academic areas. But it's crucial to remember that there is hope. Treatments for these disorders are continually evolving and improving. Cognitive behavioral therapy, or CBT, is one of the most effective treatments. It involves working with a mental health professional to understand and change thought patterns that lead to harmful symptoms or behaviors. Eye movement, desensitization and reprocessing, or EMDR, is another promising therapy. It aims to reduce the intensity of traumatic memories through specific eye movement exercises guided by a therapist. Support systems are also vital. Connecting with others who have experienced similar traumas can provide comfort, reduce feelings of isolation, and provide practical advice. Trauma and stressor-related disorders can be debilitating, but with support and treatment, individuals can find relief. Mental health disorders, while challenging, do not define a person. In our journey through the landscape of mental health, we have explored 7 categories of disorders. We've seen how anxiety can trigger excessive fear and worry, and how mood disorders can create intense emotional highs and lows. We've delved into the distorted realities of psychotic disorders and the consuming obsessions of eating disorders. We've looked at the rigid patterns of personality disorders and the intrusive thoughts of obsessive-compulsive disorders. Lastly, we've addressed the powerful impact of trauma and stress-related disorders. Each of these disorders presents unique challenges, yet they all share one common thread. They are part of the human experience. By understanding these disorders, we can foster a culture of empathy and support for those who live with them every day. Remember, understanding leads to compassion, and compassion can make a world of difference in someone's life.